Now, to notice where the muscles are, we ask the patient to frown. Okay, thank you. Please remain with the frown position. You see that there's some tension going from here medially, and some tension here, certain ridges form in here. So this is the lateral aspect. We will not inject laterally from here. Now you can pinch the muscle, because the pinch is a little fuller in this part, and this is where the muscle is located. So I will I will just mark the area that we will treat. Now, I mentioned that there are some structures that we want to avoid. So the first structure is the supraorbital artery. We should ask the patient to open her eyes, okay, and look straight. The supraorbital artery enters this area along the vertical axis from the lateral iris. So it should be somewhere here. The majority of people have a little bump here that we can feel. Yep, here it is. Make sure you don't inject right in this point. And this is how the artery proceeds further. So we should mark the same area. Please look forward. Thank you, here it is. We have marked the location of the supraorbital artery. Now the next artery that we want to avoid is the supratrochlear artery, and its anatomy is more variable, but there are signs how to locate that artery. Usually the artery passes from under the orbital rim on the frontal bone, approximately 10 millimeters medially from the insertion of the supraorbital artery. So it should be somewhere here, right? And there is another way how to check if the artery is here. And we need to just pinch the area and note where we have the ridge appearing. You see the deepest part is here, and the muscles usually deform in the area which is the softest. And here we have that artery. Now we need to do the same on the other side. So we imagine that 10 millimeters should be around here, and we pinch. Yep. It's here. Good. So we have the area marked, we have the dangerous structures marked. Now we need to mark the injection points. The procerus muscle is located right in the middle of the glabella. It's a triangular shaped muscle, which is here. We need to inject 1 point, so I mean 10 units of botulinum toxin into this muscle, in the middle of the muscle. And this injection should be placed superficially, just below the skin. Now, I mentioned that the corrugator superciliary muscle, in different parts of the muscle, it's located in different depths. And you need to evaluate that too. So, in the medial area, the corrugator superciliary muscle is deeper. And if we want to hit that muscle, if we want to place botulinum toxin correctly, we need to insert the needle a little deeper. And the injection points where I would inject botulinum toxin in the corrugator superciliary muscle are these two, not over the artery. And the next point should be somewhere here. Also, we avoid where the arteries are, and in this area the corrugator superciliary muscle pierces the frontal muscle, and it becomes located in the superficial plane. So in here the location, the injection should be deep. In here the location should be superficial. Now, please note that we are near the no injection zone. I'd like to repeat, never inject here. And here we have the patient evaluated and the injection points marked to treat the so-called anger wrinkles, or the wrinkles of the glabella complex.